Hi there, and welcome. My name is Bruce Potenza. I'm the director of the Regional Burn Center here at the University of California, San Diego. And we've prepared a series of small talks to help us teach pre-hospital preparedness in the case of a burn disaster that might occur here in the San Diego County. We have two types of modules that we have put together. We have a 60-minute module that is very comprehensive and exhaustive, covering a number of issues, including the reason for a San Diego Burn Search disaster program, dealing then with the initial management and triage of burn patients, and then some basic physiologic principles in what to do while you're transporting the patient. We remember that during the 2003 and 2007 fires, sometimes patient transport times were very long, and as a result of that, the beginnings of resuscitation needed to be started, as well as some very basic wound care management. And we're going to try and cover those over the course of that 60-minute module. We have a second series of modules that are very small. These are going to be just little 10-minute talks covering very specific areas. You'll know there's a website called TED Talks, TED. And TED Talks are little 10-minute talks done by people who are very knowledgeable in their field. And so it tries to give you a very concise idea of the topic matter to be covered. So today's talk is just to introduce to you the burn search program and why we need to have that in San Diego County. Well, is there a need for a burn search program? Are there burn disasters that occur here in San Diego? Let's go back over a few years and just look. In 2003 and in 2007, we had the very large San Diego wildfires. And as you can see from this map, the wildfires affected areas in the northeast portion of San Diego County, coming down through Escondido and Valley Center, as well as coming from the southeastern portion of the county, Otay, Mesa, coming across the Mexican border and staying in some very largely uninhabited areas, but crossing through a number of dwellings and homes, causing casualties to fire personnel, as well as people trying to defend those homes, as well as people that were caught out into the field. So in both fires, we had about 50 patients transported to the UC San Diego Burn Center, and you brought those to us. And you brought those to us using a combination of helos and ground transportation when the helos could no longer fly. And if you remember, those of you who did that, there were times in which there was so much soot and smoke in the air that the helos needed to be grounded, and then secondarily there was so much traffic on the ground that you really couldn't transport the patients to us in a reasonable amount of time. So difficult things to think about here. In 2010, we had this F-18 crash in the area of University City. And although the casualty count was fortunately very, very low here, you can see the great potential. As you look here, this is the aerial view of where the plane actually landed, right on the edge of a housing development. And here you can see the devastation that it caused to a number of houses. Unfortunately, there was one family that was severely and fatally wounded in this, but the surrounding houses did not have people in there because it occurred during a time of work. So the potential for a large-scale disaster related to burns is really something that San Diego needs to think about. And if you look here, this is the San Diego Hilton explosion in 2008 downtown, when they were still in the process of building this hotel. There was a gas explosion and 5 workers were hurt. Had this occurred in a different area during the construction, or had a gas explosion occurred while the hotel was being occupied, perhaps this would have been a significant burn disaster event. So we really need to think about it. So there's compelling evidence that San Diego does have smaller burn problems, burn disaster problems, if you will, in which we muscle up and surge up and take care of the patients. But really, we would need to have a much bigger plan. And so as we think ahead, are we the only one out here? We really are an isolated area of burn care in Southern California. If you look here, San Diego Regional Burn Center at the University of California sits here. The closest burn centers are Arrowhead Burn Center up in San Bernardino Riverside up to 15, which is approximately an hour and a half, 2 hours away from here. And then we go into the Long Beach area where we have UC Irvine and the Grossman Burn Centers. And then as we go north, we have USC, another Grossman Burn Center, and the Torrance Burn Center. That's all we have in Southern California, and all we have in San Diego County is us. And what does the University of California Burn Center look like? It's an 18-bed unit. 8 beds are intensive care and 10 beds are step down. And this is what we have to take care of a population of about 3 million patients. And if you remember, if you think back in the 03 and the 07 fire, our ability to move out of the county on Interstate 15 was completely cut off by the fire and the smoke. We also had fire and smoke coming across the 8, and we couldn't get out that way. And coming up the 5 was nothing short of gridlock. So moving patients from San Diego County up to Los Angeles County, San Bernardino County, and Orange County is challenging, particularly when our aircraft are unable to fly due to the weather conditions here in San Diego. So we really need to consider ourselves an island of burn care for at least 3 days, according to the federal guidelines. And I think that's reasonable because we've learned from history within the first 24 hours, all our aircraft is usually grounded once the skies are so full of smoke and soot, etc. And it's somewhere around the 36 hours where aircraft begin to get back up in the air. So that's at least in a day and a half. So we should be planning for a little bit more than that. So how can we, if we're a burn center of only 18 beds, how can we accommodate these 50 patients that are coming to see us? We admitted 22 of them in both of the instances in 07 and in 03. We do that by doing something called burn surging. And what surging means is that we have the ability to increase the amount of beds that we have available to burns at any one time. Now that's kind of tough, and what's tough about this is usually our burn center runs about 80% capacity. And running 80% capacity on an 18-bed burn unit means we have at any given time only about 4 beds that are open. So how do we achieve this? We achieve this by discharging patients earlier than they may normally be discharged. We move patients off wards to the other surgical wards, to the medical wards, and out of the intensive care unit, we move patients from the burn center into other intensive care units, particularly those patients that are here just with smoke inhalations or complications requiring them to be on a prolonged ventilator. So things that are not labor-intensive burn cases will get moved to other units. And we enlist the help of the other units, particularly the surgical intensive care unit, to help take care of our patients. And they're really good about that because they deal with trauma patients all the time. And burn patients are just a form of trauma patients, if you will. So recently, the federal government has mandated all the large urban counties within the United States to have a plan for each million inhabitants of the county. And that plan is that there should be 50 beds available for the care of burn patients in the event of a disaster for every million patients. And so San Diego County is slightly under 3 million people. That would equate to about 150 beds. Now, as we go back and look through history, and we go through all the major burn disasters in the United States, it really looks like for a city of about our size, we should be planning for 50 or 60 patients. But the feds are asking us to plan for 150, and that's a huge undertaking. And let me show you the model that the San Diego County Burn Surge Program has developed with the San Diego County Emergency Medical Services and UC San Diego. How will we do this? If you look here, this is the typical San Diego County trauma map. We have catchment areas here. We have Palomar in the north, Scripps on the west, Sharp in the central, Mercy and UCSD. Depending on where you have your injury, you'll be transported to that institution. In the event of a mass trauma casualty event, we will send patients to the various trauma centers in each one of these areas so as to offload the patients and not overrun any particular trauma center. We plan to use this for our burn patients also. So the primary receiving hospital in the event of a burn disaster will be UCSD. UCSD will take all the biggest and the baddest burns that we have out there. Smaller burns, burns that are less than 30% total body surface area, or patients who have strictly smoke inhalation, the secondary tier of admitting hospitals will be the San Diego trauma system. It's good. It knows how to deal with trauma patients. It has a system set up within the hospital as well as a countywide system of dispersing patients. This will be our second tier of patients. So if we look here, we have UCSD as a primary triage. Secondary triage are all of the San Diego trauma centers. And tertiary triage include the larger hospitals in San Diego that have ICU capability to take care of critically ill patients. So that will be our third level of patient triage within the county. All the triaging that will occur the same way that your trauma triage occurs right now, through your MICN. So when we get a call that there's a fire, there's an explosion downtown, there are potentially 50, 60 burn patients that are down there, we will activate the Annex 1 of the San Diego County EMS system, which is the mass casualty event. Been in place for many years, works really well. We just have an added component of this that has a burn disaster. And this is what the MICNs will be looking at. So they will decide as you call in and say, I have a 45-year-old male, appears to have a 50% total body surface area burn, coughing, having evidence of flame burns to their face, obvious inhalation injury, where do I go? The MICN will look on their chart and say that's a UCSD burn center patient and will route you to UCSD emergently. The second call might be in the rig behind you who has a 25-year-old male who has a 15% total body surface area burn, no inhalation component. This might then be sent to one of the San Diego trauma centers by the MICN because he's not meeting the initial triage criteria to come to UCSD because we're expecting bigger burns, but meets the triage criteria to go to a secondary area, that being less than 30% total body surface area burn. So this might get routed to one of the 6 trauma centers. Now, UCSD is one of those trauma centers, so we're included in the mix of primary burn admissions, number 1. And number 2, Rady Children's is also one of those 6 centers. So we're really only left with 4 adult centers: Palomar, Scripps La Jolla, Sharp Memorial, and Mercy, to divvy up adult patients as they move through the system. So let's say UCSD becomes full with its capacity of burn search and disaster patients. Let's say the San Diego trauma system becomes full, and our estimated maximum amount of patients will be probably 10 patients per trauma center. Initially, we would like to keep this only to 3 to 5 patients per trauma center, but in a mass casualty event where we had this many patients, each trauma center would be expected to handle at a maximum 10 patients sent to them. Now we go into the tertiary areas of receiving, and again, those are the larger hospitals, non-trauma hospitals within San Diego County. Again, all this is being run through the MICN. This is not things that you have to decide as you're driving the ambulance, gee, where do I need to take this patient? You give the call to the MICN who's running the disaster will have this sheet in front of them and will direct you to the appropriate place to go. So it looks just like when we have a multi-car accident on Interstate 8 now during the holiday season, in which we have 16 patients that need to be dispersed throughout the trauma system. We're following the same way that we do this. What's our overall plan? Our overall plan is a 72-hour, 3-day plan. And that is that when these patients go to the outlying hospitals, the trauma centers, or the tertiary receiving centers, our goal at UCSD is to get them back into UCSD within 3 days, or have a way that these patients are discharged from the hospital if it's not a very severe burn injury, followed up at UCSD in our outpatient clinic, or if these are very seriously injured patients, UCSD cannot accommodate them, then working with the County of San Diego, we have a plan to move patients outside of the region. So to move them to Orange County, LA County, San Bernardino County, etc. So this is what we have available to us to move patients out of the county should they be required to be here longer than 72 hours. So as I think about things, and what I want to leave with you right now is this. There is a plan for burn disaster in San Diego County that looks very close to the trauma disaster plan we have for the county. It uses the same infrastructure, the same platform, the same MICNs, and the similar training that we have for trauma right now. We're going to move that over on a burn platform to accommodate burn patients. When you get your patient from the area of this county that the burn disaster is taking place, you simply call the MICN the same way you do. Just so that you know, there'll be an incident commander that will be set up as quickly as possible at the site of the disaster. The county will probably be setting up their incident command, and UCSD will have its incident command center already set up to try and accommodate and coordinate the movement of patients throughout the county. Our goal is one movement of the patient on the day of the disaster, and only one. That is from the scene to the appropriate receiving hospital, whether it's UC San Diego, or whether it's one of the trauma centers, or whether it's one of the participating tertiary receiving centers. One move for that patient on that day, and that's it. At the end of the 3 days, those patients will be moved back either to UCSD, discharged, or moved out of the county. So I hope this gives you an idea of what the burn surge disaster plan is about. This is only our first module to kind of get you introduced to this concept. Our second module will have an initial evaluation and management of the patient, as well as dealing with some of the triage, field triage characteristics that are unique to burn patients. We'll be talking about both adult and pediatric patients because we take care of all these patients at UC San Diego, and we'll be taking care of these all throughout the county. And this is where Rady Children's Hospital will really be standing up to assist us with the care of children. So I thank you for your time. I look forward to coming back with you at a few more of these 10 to 15 minute short talks, and I hope this makes some good sense to you. Look forward to working with you. Hope this is a quiet fire season as we move into it into the fall, and thanks for your attention.